Thank you. All right, welcome everyone. This is our third work group meeting of the Gender-Affirming Care work group. Here's our agenda for today. We just went through welcome introductions. This is the agenda, and then we're going to share some proposed working agreements. If we had more time, we would, probably take the time to co-create these and make sure everyone has contributed. But given the short amount of time, we're going to propose some and ask you all to kind of adopt these. For our short work together. Then we're going to do a quick project plan overview, and we're going to talk specifically about like the charge for this group and how that translates into our meeting schedule, cadence, kind of timeline, and some deliverables to make sure that we're all on the same page. And if you have questions, that we can tackle those. Want to spend the bulk of our meeting today looking at and discussing the results from the Gender Affirming Care Policy Recommendation Survey that OHA sent out to folks on November 1st, right? And so we had some responses there. We're going to look at what we heard and then have some discussion around, what might be missing, what we'd want to add, if there are folks here who didn't get a chance to take the survey, if they want to weigh in, that kind of stuff. That's going to help us start to identify our short and long-term recommendations that this group is going to put forward. And then finally, if we have time, we're going to do a short discussion on decision making and just kind of get a sense of where this group wants to go and how we want to operate in terms of decision making. Are we doing consensus? Are we just kind of putting everything forward? That kind of conversation. And then we'll talk about next steps and wrap. So that's our agenda. Hopefully after this, we'll all have a clear sense of our deliverables and how we're going to meet them. And we'll have, again, started to identify some of those short and long-term recommendations that will go ultimately to the Health Equity Committee and the Healthcare Workforce Committee, the Oregon Health Policy Board, and eventually the Oregon Health Authority Director, Dr. Hackey. And then, again, talk about decision making. So next slide, please. Okay. So these are some working agreements that we wanted to put forward to, and there was a quick edit. So the ones that were sent out to you or in the meeting attachment don't necessarily have the most updated language. Thanks to Alex, we caught some ableist language and we did modify them. But for our time together, we're hoping people will both take space and make space, and that's typically if you don't contribute very often, maybe push yourself to try to contribute a little more. If you dominate conversations, maybe try to, share a little less. This what we pay attention to grows is really about mindfulness, right? Like where we put our energy is where we see results and growth. And so really wanting to make sure that we keep focused on our task at hand. Confidentiality, most folks have heard this, right? Take the lessons learned, share. We want this to spread and impact, but leave the details behind. Don't share other people's stories without their permission and with the details. We like to practice yes and or both and. This idea of multiple truths can exist at the same time. We can honor multiple experiences. Value as much the process as much as the outcomes. So again, things like taking time to introduce ourselves and get to know each other is just as valuable as the products that we're working towards. Be aware of both intention and impact and attend to both, right? I don't want to say assume best intent because not everyone always has our best intentions in mind, but I do want us all to attend to the impact that we may have, whether it was purposeful or not. And so think about that. And remember why we're here. And of course, please have fun, be present. It is a lot of work in a very short amount of time. And so we do ask for your grace because we are, taking some shortcuts here. So with that, I did want to ask, is there anything the group wants to add that like I can't live without this working agreement before we move on? Yes, and I see we have Danielle joined us. Danielle, welcome. We are just working our way through the start of our meeting and just went through some working agreements. Love to hear if you want to we all introduce ourselves. If you want to pop on real quick and just introduce yourselves, we should name, pronouns, affiliation or role, and then one self-care or community care practice. You're welcome to share if you feel comfortable.
Sure, I'm just regretful that I missed other people's self-care during this time. It would have been
Yeah,
nice. Um,
yeah, yeah.
so, yeah, my name is Danielle Mancuso. I use they or she pronouns. I'm the gender affirming care coordinator here at La Clinica in Medford. Um, self-care, just reminding myself to get up and move around every once in a while right now. Yep, just change locations.
Mhm. Well, thank you, Danielle. And yeah, if others want to put your self-care in the chat so that Danielle can see and benefit from everyone's wisdom, feel free. I'm not going to force you, but that is one way we can kind of bring Danielle into the loop. So thank you and welcome for being here, or thank you for being here and welcome. All right. Any working agreements people want to add? Oh, suggestion. Something that can really help reduce feelings of gatekeeping exclusion is trying to limit acronyms. Yep. And or explain them when you use them. Perfect. So we will add that to try to attend to inclusivity and avoid acronyms. All right. Cindy, if you can help me capture that note, that'd be perfect.
You got it.
Okay. Well, this will come back, so it's not going to be the only time we can modify these, but I am going to move us forward so that we can keep getting our work done. All right, let's go to the next slide. We're going to now do a quick project plan overview and again, talk about our charge. Can you go to the next slide? And so when I was looking at some of the background material, and I just a way again to make sure we're all on the same page, it seems like our charge as a work group is really providing those short and long-term recommendations to OHA on how to improve the training, hiring, and retention of gender-affirming care providers, right? It's really that improve the training, hiring, and retention. And that we're supposed to launch conversations and report back to OHA on those preliminary recommendations. So how that charge translates into the deliverables, and here is where I really want to, welcome if you have a different understanding or if you want to help nuance this a little more, feel free. But our understanding is that by the end of our time together, we're going to be submitting a memo and presentation that outlines some short-term recommendations, and short-term means recommendations that OHA can take that don't require legislative action, right? We're going to submit some longer term recommendations that may require legislative action and that should be further explored and refined through a process in 2025. So we're not going to like finalize those longer term ones in this work group, but we're going to say here are some that we should explore and we need to refine in 2025. And then finally, I also understand maybe put forward a recommendation for a process, structure, timelines, and expected outcomes for another group like this in 2025 to work with those longer term recommendations. Does that match or align with what you all read or understood the charge to be? Does anyone have any clarifying information or questions? Just take a moment to look through. No? Okay. Well, let's then look at our plan. Let's go to the next slide and say, how do we get that done in just a few short months? So you saw this maybe if you attended one of the previous two meetings of this work group. So I'm not going to go through complete detail here, but you'll notice that there's a star in this meeting 3, November 13th. So there's 5 work group meetings. And I know you started discussing some concepts last meeting. Today, we're going to dig into some of those preliminary recommendations that came out of the survey. We'll meet next Friday on the 22nd to continue working on some recommendations, those short and long-term ones that we're charged with producing, as well as start to dig into our recommendations for that 2025 work group process and timeline. After Friday, the 22nd, you'll see in the little red text here, we will be sending you, our goal is by November 27th, a draft of that memo with the recommendations for your review. Because on December 4th, which is our last work group meeting, is where we're hoping to have a preliminary approval of those. So it's going to be very important for you all. I know this is a lot to ask, and it's a very tight timeline, and it's over holidays for some. Is that from 11/27 to December 4th, there's a short window for you to review and get us feedback so we can incorporate those and have a final set at that December 4th meeting for your approval. Okay. That then will help us kind of achieve that first two charges or the charges before us. And then we'll present that to the different committees that are represented here, as well as OHPB, and then submit it to the OHA director. So that is the path forward. It's a lot. And so I don't love asking people to do work between meetings, but I think that's probably where we're going to be. And if there's anything that we can do as your facilitators or note taker to make it easier for you, please let us know. We'll do our best to accommodate so that everyone can have their input heard and acted upon. Any questions on timeline, task, a plan for the next couple of meetings and what's coming? All right. Well, then let's turn our attention to the survey and start discussing that. Okay. So let's go one more slide. So just a quick reminder, OHA sent out a survey, a gender affirming care provider workgroup survey, November 1st, really to jumpstart this conversation and get some preliminary thinking. We asked people to select their top 5 short-term and long-term policy recommendations. There was also an option to write in other policy recommendations in case there were some missing, and we're going to share some of what we heard in case folks want to, vote for that as well. And then there was a space to talk about CCO 3.0, which we're probably not going to focus on today because we want to work on those deliverables. There were 15 total responses. 8 of them came from OHA staff, 4 of which are directly involved in this work group. So the folks that you probably are been working with for a while who are dedicated to this work. And then 6 members of the external work group contributed as well. 3 were also members of the healthcare workforce. 2 are also members of the Health Equity Committee. And 1 is from that House Bill 2235 work group, which was all spelled out as input that we should be getting. And then there was 1 response from a psychologist at the Oregon State Hospital, but that was not on the work group. So that's what we have. Let's look at the next slide. This is, I apologize for the amount. This is the results of the short-term survey, right? So these are recommendations, again, that do not require legislative action, and they're organized from the top down on most prioritized or most voted on by those 15 people. And so you can see it starts at the top with supporting gender affirming care, organizational changes like signage, billing forms, bathrooms, etc. Some training around gender affirming care, providing gender affirming care at school-based health centers. So you can kind of see how they're going down. I'll let you read those. What I want to note is at the bottom, there are 2 that are new that did not show up on the survey that I do want to read out. One is call for the formation of an official gender affirming care advisory committee that is compensated, comprised of trans and non-binary patients, providers, and knowledgeable allies, with a seat at the table, which means access to power and decision making, right? Charged with developing comprehensive community-driven recommendations beyond this group. So this is a recommendation that really does align with one of those charges of coming up with a recommendation for a work group to take this work on in 2025. And then the other write-in option was create/support a gender affirming care peer support group for providers moving this work forward so that they have some support from their peers. I want to give you a moment to look at the rest of these and kind of have that question. If you didn't take the survey, are there any things that you would want to add in now, things that aren't here? And this, again, not the only time for you to share, but just wanted to make space. Given the election, does anything change for us in these recommendations? And we'll just pause. Stephanie.
Yeah, I wanted to ask about the number of respondents and the impact of 15 responding in terms of the I guess, the strength behind the recommendations?
Ooh.
Something that we want to have more respondents on, or is this sufficient?
Um, that's a great question. Um, and I will take a run at answering that, but also welcome others to chime in. I mean, I think in an ideal world, we'd have more participation, and we know with the timelines that that may not be possible. But I don't necessarily see this survey as resulting in the recommendations from this work group. I think it's just a way for us to start to either see what's emerging as priorities. I think we can still talk about, and one of the questions we have to talk about is, does this group want to like prioritize a few recommendations, or do you want to put forward all of them and just say, here's the ones we would start at the top and work your way down? Or, I think that's still up in the air. So I don't necessarily know if the limited number of participants necessarily negatively impacts what this group can do. I don't know if that's helpful.
Yeah, it is. Thank you very much. I appreciate that.
Yeah. Other thoughts, questions, or reactions to this?
I have a question.
Yeah.
I'm wondering what are like, do we feel the need to get more specific about support? I know
Mm.
Katrina spoke earlier about sort of what we're codifying right now. There's certain legal protections that need to happen? I know that would get into the longer term legislative piece. But I'm thinking specifically about care at school-based health centers. Are there certain programs that we need to fund? Are there certain positions we need to protect as part of that support process? I'd be curious about choosing our words carefully and
Yes.
making sure that the support we want is what we're being clear about.
Yes. Words definitely matter. Yes. And we'll see. So we're going to do this. There are a couple slides in a few that have some questions for the group. And one of them is, how do we want to refine or nuance these a little bit more? So these are how they're worded in this survey. They're not ready, right? Part of what we'll do from this discussion and the next discussion we have is draft, hopefully more robust defined recommendations, incorporating as much of your input as we can for you all then to react to and do more refinement. But yeah, so some of those might be, choosing different words if we need to. Katrina.
Yeah, I also think we're maybe unbeknownst to y'all, but we're soliciting exactly the type of feedback that we were hoping to get, which is by using a vague word, it leaves things pretty open-ended, because there might be a multitude of ways that we can support gender-affirming care training. And we don't want to limit just one in this initial round of screening. And so I think also as things rise to the top of what could be priorities, that's where I would love for each of us to think what our definition of that is, and then recognize there might be a multi-prong way that we achieve each of these goals.
Lovely. Thank you, Katrina. Other folks? If you think of anything that you would add that isn't here, feel free. I mean, it's kind of a messy process, so just get as much of your thoughts out here for us to work with as possible. So if you think of something that's missing, you can also feel free to drop it in the chat. We will add it to the mix. One idea I had when I was looking at these is, we could sometimes, if there's a lot of recommendations, it can be overwhelming. And so we could also decide to categorize some of these. So there are a few around training, right? And we could have one recommendation about trainings that should be available or provided, and that could include kind of all of them to streamline a little more. So that's another idea that has come to mind around these that I've thought about.
Michael, I don't know how to use the hand raise
Oh
feature,
yeah,
so I'm just going to
really,
talk.
please, yes.
I am, I think I put on the survey one issue around for patients who don't have support to create a program, a care program that could provide that support for post-surgery care or even, injection anxieties and things like that, that we have a program in place a caregiving program.
I love that. Thank you, Danielle. And Cindy, let's make sure we capture that in the notes as one of the recommendations that we
I'm
can
on it.
add. Okay,
Mhm.
lovely. Thank you. Del.
Yeah, I just wanted to follow up to your suggestion about potentially, you know, encapsulating like the training together because I noticed when I was taking the survey, I was then having to read what each of the different trainings is and then sort of prioritize which one felt more important than the other. So I like that idea of making training be inclusive of those various varieties. And I think, how I would have ranked some of the others would have perhaps been different if that had been that way on that survey.
Oh, good point, Del. Thank you for that. Yeah. Okay. So support for kind of organizing some of these together. Okay. I'm just watching the time, so I'm gonna suggest we look at the long term and see there, and they'll give you time to process a little bit more, and we can continue to share input. Jessica, let's go to the next slide. I want to show you all how the long term recommendations kind of fell out, and again, long term are the ones that are likely going to take legislative action. And so, this is stuff I think my guess is that the recommendations that this group puts forward for long term are going to be pretty high level, not as fleshed out, because it's really like these are the areas that we want to see the next group spend some time critically going through and developing the recommendations for a policy. But what was put out there were very similar in terms of some of the trainings, but instead of support, this is a word choice where it's become mandate, right? And that is something that would require legislative action. And so you can kind of see the connection between the short term and the long term. But here again is kind of how they ranked out. The three at the bottom are the ones that were added by folks who took the survey. And I just wanted to lift those up. One was having more providers doing surgeries, especially in rural areas where there may be less access, right? And we can't forget about our friends in our rural communities because there is a lot of disparities that exist in those communities. Another one is mandate for educational pipeline changes to increase the number of gender affirming care providers, mandates to increase funding for trans and non-binary CBOs. And the CBOs, this might have been, Danielle, your comment, because I think it said in parentheses, and for space, I didn't include it all. It was like to provide support, for members of the community and education and, training. And so that's another is, actually increasing funding for pipeline workers and for CBOs serving these communities. And then finally, someone put in adding OHA policy staff positions, right? And staff to work specifically on gender affirming care and in leadership position at OHA over gender affirming care was something that someone else brought. So reactions or thoughts here from people? Anything surprise you? Things you would want to add? Things you want to double down on? Just giving people time to digest and process. Permanent approved Gender Affirming Care Workforce Advisory Committee. Thank you, Del.
I think this is Meg. I think telehealth is a lever that we can put some pressure on. It's already an established process.
Mm-hmm.
Yeah, I think that's one we can do to help minimize the issues we're having out here in rural Oregon.
That's great. Telehealth. So let's make sure to emphasize that one. Stephanie.
Yeah, I would double down on the mandate affirming HR policies. Of course, I would, since I'm in HR. But anytime decisions are made, actions are taken in any employment context, they really have to be based on policy, which is usually rooted in the law. And so I think having those in place with, in terms of procedures in the workforce that are supported by that policy, that hopefully are supported by the law as well, could be very helpful in maintaining a positive culture around gender affirming care.
Thank you for that. I did find myself wondering, not having been involved in any of the initial conversations, like what was the scope of that recommendation? Is it HR policies in healthcare settings that are providing gender affirming care? Is it HR policies just in all employment that is about supporting gender affirming care and gender affirming folks in there? Like, I don't know if anyone has any thoughts or want to, help us hone that one in a little bit more. That's welcome, certainly.
I think the latter would, I mean, and anyone else can chime in. I think the latter might be a little bit outside of the scope of of this work group, but by all means, I think it's important. And just for what we work on, we're updating our policies regularly to make sure we've got inclusive language in every single one, both in the function of the policy and in the wording of it.
Great. Thank you. Is that Lena?
Yeah, and just to build on that, Stephanie, you I'm sure have much more expertise in this than I do as a clinician, but I'm thinking of like the focus of this work group, and the idea is to expand access to gender affirming care within Oregon. And so I'm thinking like of that as a downstream or upstream effect, that if a healthcare organization has affirming HR policies, then someone that is trans or non-binary or provides gender affirming care, cares about those populations, might be more interested or willing to work in a healthcare setting like that. And so I think that could ultimately lead to increased access to gender affirming care. I agree with you, Stephanie, that while personally I absolutely support affirming HR policies across the state in all organizations, our role is not necessarily that of HR doctrine across the state. So
well said. Well said. Let's not set OHA up for unrealistic expectations.
Certainly in healthcare settings, when policy is there to support something, it's kind of the top-down approach. It becomes part of the culture. It becomes an understanding of that workplace. So I agree. It would be great if it were inclusive to all employers in the state of Oregon, but definitely within healthcare.
Okay. Thank you. Love that. Appreciate it. All right. I think what I'm going to do is, we do have 2 slides with some questions for your consideration, and we certainly won't be able to get through all of them for each topic, but I did want to introduce them as a way of getting you all thinking, and then maybe hear from you what would be the best way to get your thoughts further on these specific recommendations, because I don't know if we're going to have enough time in the workgroup meetings to hear from everyone. And so, when we were looking at these survey recommendations, we thought, of course, there's the like, are we missing anything? The question we asked around, does election change anything? But the other ones are, do we want to prioritize or put forward a subset of these as a work group? Or are we going to take the approach of we're going to put forward all of them? We're not necessarily going to rule any out because we want to aim big. So that's one I love for you to ponder. the other is, do we want to include other criteria or content along with these recommendations? And this gets at kind of flushing these out a little bit more. Like, do we want to turn and look to our OHA partners and say, can you help us understand which of these might already align with efforts at OHA that might have more traction and we'd want to prioritize those? Or, is there a way for you to kind of assess the size of potential impact of some of these or success? And do we want to include that in our recommendations? Any thoughts about that? Or use that content to help us prioritize? And then we already talked the one about combining the trainings, but that's some of the questions related to this work group and some of the recommendations. And then let's do one more slide, and then I'll just open it up for general discussion, and you kind of keep these in mind. Then when I start thinking about the actual recommendations that we want to put forward, there are some questions that I think if we found a way to discuss, that would help us further flush out what the wording is that we want to put forward with these recommendations. And that's like, for each of these recommendations, what is kind of an ideal outcome in Oregon that we'd see? Like, what do we think that will change in Oregon? And what activities might it take to make that happen? How can we embed equity and anti-racism into the recommendation further, right? We know that a lot of folks have intersecting identities, and are there ways to kind of uplift even more anti-racist or equity behaviors into these recommendations? And then how can or should community be engaged in these? And this is probably more for the longer term recommendations, because the short term ones, we probably don't have time to engage community. But those are just some of the questions that have, as facilitators helping, we've kind of thought about with these. And I'd be curious to hear from you all. What do you think is the best way for you all to have that dialogue or chime in? I don't know if we have space in these meetings for all of it. Are these the right questions? So let's just get some thoughts from you all around that. Do these questions that are in front of you look like the right questions to go deeper, Stephanie?
I know I've spoken a lot today, so sorry if I'm taking up too much time here, but I wonder about the law in Oregon in terms of as it relates to gender affirming care. Is there anything that is permanent, like part of the Oregon Constitution, that provides further protections as well? And do we want to make recommendations along that line if those aren't there?
That's a great idea, and something I bet you our people at OHA can help us dig into. Thank you. Reproductive Health Equity Act is someplace to look. Okay, great.
And Michael, I really like these questions. I'm struggling though to think of them sort of en masse with all of the recommendations. So I'm wondering if we could workshop it with one, or if there's one that we feel super strongly about, maybe trying applying these questions to that specific recommendation might make it feel more approachable.
Yeah, I think in a perfect world, we would ask these for each recommendation we're going to put forward. And I guess that's my dilemma that I'm hoping we can all kind of collectively come up with a solution for, is we don't have enough time in our meetings or enough meetings to do that. If these are the right questions, should we do another survey and ask people to weigh in that way? Do we have some optional drop-in times that people who do have time can come in and tackle some of these questions? Because it is overwhelming to think about it in whole, and I don't know how to get through them all. Certainly, we could do one just for us to kind of get the flavor and see the impact of it on one right now if we want to. If the group people want to give me a thumbs up if you want to try that with one recommendation, we can certainly do that. I see some nods, some thumbs up. Okay. Let's pick a short-term recommendation. And yes, some of these, Katrina, right, are how. All right, let's go back 2 slides and let's pick a short-term recommendation. One more slide. Let's just pick, let's do support gender affirming care at school-based health centers. Let's try that one. Okay, so now that that's in our mind, that's what we're going to focus on. We want a recommendation to support gender affirming care at school-based health centers. So let's now, sorry, Jessica, I know. Back to you. There we go. So what is the ideal outcome that we would see in Oregon if there was support for gender affirming care at school-based health centers? What might the ideal outcome be?
Hey, Michael, this is Alex
Yeah.
from OHA. I'm imagining something like the ideal outcome would be that gender affirming care is readily available for young people in schools, and protected, through both program and policy and law.
Mm-hmm. Lovely, thank you. And I see Katrina put gender affirming care at every school-based health center. Right, that gets at the available, protected. Ian?
A clear gender affirming care framework and a series of protections that administrators of those health centers can work off of to focus the conversation and continue to generate better gender affirming care within their health centers.
Love it. So infrastructure related to that to support. Love that. Okay. Ideal outcomes. Great.
Yeah, I love that, Ian, because I think I'm imagining, right? Like, we're not expecting surgeries to happen within school-based health centers, and we want kids to feel comfortable walking into their school-based health center and starting that process and determining if surgery is where they ultimately want to end up. So I think that idea of a framework, or sort of what is standard, what we expect, what the expectation of standard practices at school-based health centers could be great.
Yeah. After running a primary care clinic for 12 years and making these things up as we went along to try and provide the best care we could, as administrators, it's much easier to work off of an existing infrastructure than it is to start with a blank slate and generate from there. And I think that there's a lot, we could leverage a lot more with a starting point. And thank you, Elena. Yeah, great.
Great. What about other specific activities? Like a framework is a very specific activity to help us get there, right? Are there other things like that people can think of that would help us realize supporting gender affirming care in all schools? Or your ideas for how we might embed equity and anti-racism further into a recommendation around supporting gender affirming care in high schools or in schools?
I think that fits there.
Think that fits there?
I think that fits there. And I also think mandating training for providers and staff at school-based health centers. I mean, if we're gonna do this on the patient side, right?
Mhm,
We need to do it on the provider side as well.
Okay.
So they're met, right?
Yep,
So they're
yep.
well prepared and met. So
Okay.
I
And
think it's bold and I think it's beautiful.
lovely. I do think that will probably end up, I think anything that is, I'm guessing, at OHA, please let us know. I think anything that starts with mandate requires legislative action. So that might automatically kick some of that into a longer term recommendation, but that's still fine. Del?
I was just going to also add that, having ready, safe access to bathrooms that affirm you is a health issue. And I think that we can tie that into that, because there's a significant number of trans folks who get UTIs and have bladder issues and all those sort of things simply because they don't feel safe using a restroom. So I think we could intersect that in there too.
I love it. Affirmation closets in school-based health centers. Meg, I'm not familiar with affirmation closets. Is that
I hate to use the C word there with closets, but an an affirmation closet, they're popular in primary care. It is where things like binders, free binders,
oh,
things to tuck, materials to tuck, makeup, deodorant, perfume, all different kinds of things that they can just go and shop. It's very popular in primary care clinics around to have these, and they're confidential, and the kids just leave with a bag of wonderful things that they need. Yeah,
I love that. Thank you for sharing that. And and I know Katrina, you put into the chat earlier that some of this might start crossing over into the how, which we may not necessarily get into, but this is really great. I think this feels very helpful, and I have more clarity around some of the recommendations that we're wanting to make. So I love that. Menstrual Dignity Act 2. Yeah. Let's just try. I know we have, I want to stay on some time here, but let's think about so if we were, Meg, in your ideas, let's say we're going to cross into the long-term recommendations and we want to mandate something just to kind of test out this question. How should community be engaged in that? So if we're going to put forward a recommendation around mandating training for all care providers and school-based health centers on gender-affirming care and having, let's say, access to affirmation closets, what does this group think about the role of our communities in developing those recommendations or fleshing out? Ian?
I'm not sure if I'm answering your question or coming up with a different direction. So just to say that.
No worries.
I'm wondering if we are necessary, even if we're talking about mandate, if we're looking at a mandate, can we set up the requirements analysis, the community input, things that would not necessarily require legislation to do the groundwork in the short term to move forward into a more developed, more legal kind of framework. That's my.
Yeah, and I think if I'm hearing you, I'm hearing that some of our short-term recommendations could be things that support or lead to the longer-term ones that do take legislative action, but the ones in the short term would be doing some assessments or doing some engagement to lay that foundation.
Correct.
Right.
Because
Lovely.
we're gonna, as we're noticing now, it takes a lot of time to get from point A to point Z or wherever we're going. And the sooner we can get these conversations on the table and acknowledged as part of process might better support us moving forward to get legislation in place in an effective time frame.
Yeah.
Just a thought.
Yeah. Thank you. So I'm going to shift us a bit because I think, Elena, that was a helpful suggestion to pilot the questions on a specific example, so it's not so overwhelming. And it seemed to be helpful for folks to do that, and these questions were helpful questions. Does that match people's experience of just doing that? Was that helpful in terms of fleshing out a recommendation a little more? Let's see, does anyone have any suggestions on how we might create space or time or capacity to revisit these questions across some of the different recommendations? I don't think we're going to get it done in two 90-minute meetings. So I'm open to any suggestions. Ian? And then I see Meg, you came off. So let's hear from me and then Meg.
Do we have access to a bulletin board or some sort of kind of electronic communication? Email just seems too disjointed, to share a conversation. But I know there was a Teams group available to healthcare workforce. Anyone from OHA have any feedback?
Yeah, so a shared platform or site where we can interact, see what other people have put up there. Yeah. I will let's hear from Meg, and then let's see if anyone from OHA knows if that's possible on any of the shared platforms we have access to. Meg?
I even forgot what the original question was because I'm thinking about shared platforms.
It was how might we create opportunity
Oh.
to have these conversations or do the work of, yeah.
Well, for me, I have no PTO and I'm planning on working every day between now and whenever. So I think we can be, maybe a subset could meet if we needed to meet to have work groups outside of these dedicated meetings. But I do agree that a shared platform, where we can actively engage with each other, I think is critical.
Thank you. OHA folks, is the team site active for this group? Can we use a shared platform there to do that kind of engagement?
There are still people that I've been unable to add that are external, so it's not quite ready for that purpose yet.
Okay.
So I think we'll until that's done, we'll have to find another workaround.
A follow-up question. If I had a shared platform and I put it out for the group, could we use something outside of the state's system to do that kind of engagement? And you might need to look into that. Not to put you on the spot.
Yeah, I actually don't know. I'm trying to think of an example where I've done that for a group like this, but yeah, we will get back to you.
Okay. A jam board for each topic would be great. I love that. So, all right. So here's what I think I'm going to propose. We're going to work on figuring out some kind of shared platform that we can kind of divvy up the different recommendations or areas and post these questions, and people can start, whenever they have time to add stuff to it. I will also talk to the folks at the state around, maybe we do have 1 or 2 drop-in times for members, for those folks who would prefer to meet virtually to have that conversation, to at least get some more input from those. And so, because I see some folks are able and willing to meet outside of this meeting, but that might not be the case for all. So, and we'll see about creating some of those drop-in times for folks. So we can work these a little bit more. That will have to happen really in the next 2 weeks, because again, we're aiming for a draft for everyone's review by November 27th. So it's going to be quick, and but we'll take as much input as we can get from you all. Does that sound like a good way forward? Explore the shared platform and try to have some kind of drop-in times for folks to show up on a meeting. Okay. Perfect. Okay. Well, let's move on to our decision making, because I do want to start having that conversation and hear from folks about this. So, Jessica, can you go to one more slide? So here are some questions for the group, and we can kind of take them one at a time. But like, what are we making decisions on? Are we deciding on each recommendation and whether we approve or not? Or are we just kind of overall want to approve recommendations from this work group? Like, are we gonna just put forward everyone's recommendations, regardless of whether or not individuals agree with all of them or not? So thoughts about that? Like, did you all have expectations about that? Does my question make sense? Some work groups put forward all recommendations. Some will do some work to kind of explore them, and then we vote on whether or not we want to put forward each recommendation or not. I might suggest that we don't have time to do that kind of vetting, and that it might be more of, unless there's a large concern about putting one forward, that we're really talking about putting as many recommendations down and getting them out. Does that sound right? I see people nodding. Okay.
Just a quick comment on that. I've
Yeah.
seen it work well to sort of have a consent agenda type presentation, and then folks
Okay.
could pull off anything that they have major concerns
Okay.
with. So maybe start with a voting or a decision-making process as a block of recommendations and a
consent agenda. Okay.
needed.
Okay. I see Stephanie also put in the chat, if we have a large number of recommendations, should we rank them in order of importance? Yeah, what do people think? Do we want to prioritize or just recommendations, or just submit them all? People have one strong feeling one way or another. So I like the idea of ranking or prioritizing. I saw someone else nod their head. Okay. Ian says it might be good to break recommendations into themes and organize them, and then present all the recommendations in an appendix. Okay. So we can prioritize them, but include more information in an appendix.
Hey, Michael, this is Alex again.
Yeah.
Just on that same theme of kind of organizing, that I think that thematic organization might be helpful as well for the process of asking those more in-depth questions.
Yeah.
So that way you don't have to generate answers for every individual recommendation, but trying to kind of organize it that way.
Yeah, we'll do that. Yeah, good idea. All right. I'm getting a sense, and I'm just reading kind of, and we don't have a ton of time, but that we're thinking that we're probably going to end up putting forward multiple recommendations, that we don't really have the time to necessarily vet each one and approve them one by one. So we might use sort of a consent agenda, which tells me the group is really, ideally, we're moving towards consensus, and sounds like people are not necessarily love the idea of putting forward a recommendation that people feel very strongly opposed to. But so we're going to try to move in that direction. And we might use that kind of consensus process for that when we get there. There are some simple tools that people have used for that. And so I think maybe at that time, we'll introduce a couple options for us to use, and we won't do it just now. And then the last question that I want to ask about decision making, because I know the attendees at this group change, we're hoping to approve our recommendations on December 4th. Do you all have any thoughts around how members of this work group should be engaged in decision making? Should it just be those who are able to show up on December 4th? Do people want to kind of weigh in electronically? Is it who's here gets to make the decision?
I think if someone had any major concerns, if once we decide what platform or via email, have the opportunity to share any major concerns if they're not able to be here in person, and those could be voiced by the facilitator of that meeting, and then the group could honor that as part of the discussion.
Okay, great. And I see already two folks saying they won't make it on December 4th, and so if we send out on the 27th, give people a chance to weigh in, we send it back out, for final review on December 4th. Those who can't make it send their thoughts electronically to us ahead of time, and we bring those into the room. Okay, great. All right. I know this was very quick and we were flying through, but we have 5 minutes left to our meeting. So let's go to the wrap-up slide, which I think is in 2 slides, maybe. And I just want to, again, sneak peek of what's coming up. So we have our next work group next Friday. It's in the afternoon. My colleague Alana and I will be here together, so you'll get to meet Alana. We'll facilitate, and we're going to continue this conversation on the recommendations, talk about the process for 2025 in a work group and what we recommend that should look like. Again, we'll have a draft coming out to you on 11/27 with these recommendations then for your review so that on our December 4th meeting, we can finalize it. Somewhere in here, we're going to try to create some kind of shared platform space, probably between today and the 22nd, to start allowing you all to dig deeper on these recommendations, maybe have a few drop-in sessions, so stay tuned for that. Would love, in a very short while, a plus delta if folks, because of our time, maybe you can put it in the chat. If you have anything that you want to lift up that we could have done better in terms of these meetings and facilitation and how we spend our time together, feel free to put it in the chat. If there's anything that went well that you hope that we do, please, you can also include that. And I'll let you all do that. And as folks are doing the plus delta in the chat, I'm wondering if we could just, again, go quickly around the room and just have people share one word on how you're feeling leaving the space after this meeting. And I think to make it quicker, I'm just going to go roll call style down here. And I'm going to start at the top of my screen and ask Ian to share one word.
Hopeful.
Full. Great. Meg.
Stronger.
Stronger. Stephanie.
Safer.
Well, I'm sorry, what was that?
Safer.
Safer. Lovely. Elena.
Focused.
Dell.
Proud.
Wonderful. Alex.
Grateful.
Cool. Thank you. Danielle.
Hopeful.
Hopeful. Neelam.
Another hopeful.
Great. Mackenzie.
Connected.
Jessica.
Productive.
Productive. Great. Christina.
Hurtful.
Thank you. Katrina.
Community.
Community. And Beck, I'm assuming you're still not able to come off mute, but if you want to throw something in the chat, feel free. And thank you for being here. Hopeful. Lovely. Okay. Cindy, do you want to round us out with a one word?
Clarity.
Clarity. All right. Well, thank you all. And I see in the plus delta, sounds like people, for the most part, liked facilitation. It felt safer. I like this, love calling out specific things to be mentioned in the notes. So that's great. Mindfulness at the beginning, perfect. Okay.